Hi everyone, if you are preparing for your PHNP ANCC exam, this is a place to be. Today we are doing Domain 5, Ethical Legal and Professional Law, Part 1. In this model, we have 10 questions with rationales and exam tips that will help you. So if you have not subscribed to my channel, please subscribe to Royal Pearls Health and Wellness. Remember to on your notification button so that you will know when I drop my videos. So I have domain 1, domain 2, domain 3, and domain 4 on the channel. Please check them out. It will help you. The rationales will help you to understand the content. And also we have the exam tips that can help you to remember these questions when you see them in your exam. We are here to help you. We are going to hold your hands. Your success is our priority. We are here to help you to study with grace and pass with confidence. So let's do this together. Our question 1 says, a 32-year-old patient with schizophrenia refuses antipsychotic medications. He is able to explain the risk and benefits of treatment and communicate a consistent choice. What should the PMHNP assess first? So you see how we mapped out this question. We have the case studies, we have the questions there, and we have the options. Let us look at the options. A says insight into the illness. B, decision-making capacity. C, severity of symptoms. And D, family involvement. What do you think that the PMHNP should assess first? Put your answers in the comment section. If you chose B, you are correct. The PMHNP should assess the decision-making capacity first. Why should the PHNP assess the decision-making capacity first? Let's look at the rationale. So before overriding a patient's refusal of treatment, the PMHNP must assess decision-making capacity. Capacity is determined by the patient's ability to understand treatments, appreciate consequences, reason through options, and communicate a choice. Insight may be impaired while capacity remains intact. So the exam tips here is that refusal of treatment, you should assess the capacity first. That is the first thing you should assess when a patient is refusing treatment. So number 2 question, a 16-year-old requests contraceptive medication and asks that her parents not be informed. What is the PMHNP best action? Let's look at the option. A, notify parents immediately. B, assess state minor consent laws. C, refuse to provide care. And D, request parental permission. What do you think is the answer? The answer is B, assess state minor consent laws. States allow minors to consent to reproductive health services without parental notification. So the PHNP must follow state-specific consent laws to protect patient rights and remain legally compliant. When you look at the exam tips, minor cares, if you see minor care questions, check state consent laws. Patient states, I am going to kill my co-worker tomorrow, and provides a specific name. What action is required? So this patient told you that he is going to kill his co-worker and he mentioned the name of the co-worker. What is the action that is required? A, maintain confidentiality. B, increase medication dosage. C, warn and protect the potential victim. And D, document and monitor. Please put your answers in the comment section. And the correct answer is C, warn and protect the potential victim. You have the duty to warn. A specific, credible, threat triggers the duty to warn or protect. So as a PHNP, you must take the responsible step to prevent harm, which may include notifying authorities and the identified victim. So you have to notify the authorities and also notify the victim. When you see this in your exam, specific threat to an identifiable person, you have the duty to protect the person. You have the duty to warn the person of the potential threats, of the potential harm. An adult patient reports a history of childhood sexual abuse that was never reported. What is the PHNP legally required to do? These are some of the cases that you will be seeing even in your practice. So pay close attention. Let's look at the option. Provide therapy only, report to Child Protective Services, encourage the patient to report, document without reporting. What do you think is the answer? The answer is B, report to Child Protective Services. Why? PHNPs are mandatory reporters. Disclosure of childhood abuse must be reported regardless of when the abuse occurred, according to the state law. So when you look at the exam tips, past or present abuse disclosures, you have to mandatory report it. A patient requires a copy of their psychiatric records. What is the PHNP's best response? A, deny access to protect the patient. B, provide access unless disclosure may cause serious harm. C, release only medication records. And D, request a court order. This is request a court order. Let's look at the answer. The answer is B. If you chose answer B, provide access unless disclosure may cause serious harm. Why? HIPAA grants patients the right to access their medical record. So access may only be limited if disclosure is likely to cause serious harm, and this must be documented. In your exam, HIPAA favors access. Limit requires clear harm. If there is no clear harm, you have to provide access to the medical record. Okay. A PHNP receive a subpoena requesting patient record. What is the most appropriate action? This is one of the situations you may also likely meet when you start working. So you need to pay attention to this. A, refuse to release the records. B, release the full chart immediately. C, verify the subpoena and release the minimum necessary document. And D, ignore the subpoena. What do you think is the answer? The correct answer is C. Verify the subpoena and release the minimum necessary document. Do not release anything that you are not asked for. Just release whatever that the court wants and the minimum that you can release. Let's look at the next question. The PMHNP must verify the validity of the subpoena and disclose only the minimum information legally required to protect patient confidentiality. When you see legal request, verify, then release the minimum necessary. That is the rationale. Let's go to the next question. A patient informed the PMHNP that they want to terminate therapy early. What should the PHNP do first? This patient tells you, I do not want this therapy anymore. Why, when it's not time for the therapy to stop, what are you supposed to do first? A, agree immediately. B, explore the patient's reason. C, contact family members. And D, refuse to terminate the therapy. What do you think is the answer? The correct answer is B. Explore the patient's reason. You must explore what is the reason behind the patient wanting to terminate the therapy early. And also, these are the steps that you need to take even when you start working. You won't say, oh, because you want this therapy to end, I'm ending it immediately. Or you start contacting the family members. They don't have anything to do with this, especially if they don't have if they are not the conserved, if the patient is not conserved, the patient have full rights. So you need to explore what is the reason behind this patient wanting to stop this therapy early. When you look at the rationale, it says exploring the patient's reasoning respects autonomy while ensuring informed decision making and appropriate termination planning. So in your exam, when you see early termination, explore before acting on it. Okay. A current patient sends a social media friend request to the PMHNP. What is the most appropriate response? A. Accept the request. B. Ignore the request. C. Decline and reinforce professional boundaries. And D. Block the patients. What do you think is the answer? Decline and reinforce professional boundaries. Why? Accepting social media request creates a dual relationship and violates professional boundaries. So the PHNP should declare respectfully and reinforce boundaries. So when you see social media request, remember that it's a boundary issue. A PHNP is asked to provide care outside their scope of practice. What should be done first? A. Proceed with treatment. B. Consult supervision or collaborate. C. Refer immediately. And D. Independently research and treat. The answer is B. Consult supervision or collaborate. Practicing within scope of practice protects patient safety and license also. So consultation or collaboration is required when competency or scope is limited. That is why you have a collaborating physician. So you have to collaborate. You have to consult supervision. Do not take something that you are not that is not within your scope of practice. Outside scope, consult before acting. Don't do things that is beyond your scope of practice. A patient refuses consent to share information with another provider. What should the PMHNP do? This patient does not want you to share his or her information to another provider. What do you do? A. Share the information anyway. B. Honor refusal unless there is imminent risk. C. Explain sharing is mandatory. And D. Disregard patient preference. The answer is B. You have to honor the refusal unless there is an imminent risk. Why? Patient confidentiality must be respected unless there is an imminent danger or a legal mandate to disclose it. So you have to always respect the patient confidentiality and autonomy. During your exam, no consent, no sharing unless there is a safety risk. I wish you good luck as you prepare for your ANCC or your board exam.